Dear students, before discussing a interesting clinical case, just will go through the MCQs. Just see the MCQ, put the right answer in the comment box. I appreciate and acknowledge your answer. Xeroderma pigmentosa is A, B, C, D. Put the right answer. I appreciate your answer. Now, before going to the second MCQ, I request students subscribe my YouTube channel, share with their friends and colleagues, press the bell and learn surgery on daily, day-to-day basis with the spotters, MCQs and brief lectures. And once a week, big lecture will be there. And once in 2 to 3 weeks, live session will be there for more than 1.5 hours, where other than me, senior faculties will join, where student will present with the interactive sessions, so that we will learn how to present a case, how to discuss a case with the faculties. So it's very, very informative, and if you join this live session, you will get a certificate, it will be very, very useful for your future career. Again, this request you to subscribe my YouTube channel and share with your friends and colleagues. Hutchinson's sign is typical of A, B, C, D. Put the right answer in the comment box. And what this condition is, look at that, edema is here. See that? Small edema is there. See that? Pigmented nodules. See that? There is a pigmentation here. See that? Some discoloration here. Pigmented nodules, multiple pigmented nodules. See here, multiple pigmented nodules. So, what this sign is, multiple pigmentation in the right lower limb with the edema of the limb. Patient has earlier undergone wide localization for melanoma. So, naturally it is in-transit nodules. It is an MCQ, in-transit nodules between the primary lesion and the lymph node secondaries area. Multiple lesions in the lymphatic area it occurs, probably due to retrograde spread of the melanoma. You know that it's a aggressive malignant skin tumor. This is the commonest skin tumor, malignant skin tumor, but less. BCC is the commonest malignant skin tumor, but least aggressive. Next comes squamous cell carcinoma. It is a loco-regional disease. BCC will not spread to the lymph node. Locally malignant. It is a loco-regional. Whereas melanoma is very, very aggressive, spread to the lung, liver, bone, ribs, brain, and so on. So it is a systemic disease. The three types, three different behavior, biological behavior. So melanoma is very aggressive. Remember, these are the in-transit nodules. It says that it's advanced melanoma. So it needs chemotherapy, targeted therapy. Surgery is not possible, but outcome is poor. That is the point which you have to remember. So for detail about melanoma, in-transit nodule management concept, please go through my manual of surgery, and also how to examine these lesions, swellings, edema, and other components of melanoma. You can go through my clinical methods in surgery. And quotation of the day: your life is decided by your mind and body. So how you behave, your body language and mind language, psychological, that aspect, it decides your life actually, remember. So please students, go through my, students subscribe my YouTube channel, share with their friends and colleagues, press the bell and learn surgery on day-to-day basis. And also join live session where student will present a case for 1.5 hours discussion by senior professor other than me, so that you know how to present a case and interaction. Also you get a certificate for joining live session. Remember, students, please have my manual of surgery. It covers everything, the best selling book for surgery. It covers everything from as per CBM syllabus, with the footnote, with a lot of photos, with the pathology, management, all topics: general surgery, breast, thyroid, vascular disease, venous disease, GI surgery, urology, neurosurgery, cardiothoracic, and adjuvant therapy, anesthesia, instruments, operative surgery, and electrolytes, everything it covers with the footnote, with a lot of photos, illustrations, with the investigation and treatment management concepts, tables, charts, everything is there. And each chapter has got a link for live online with a lot of MCQs, which is very useful for your competitive exam like NEET. So it covers everything for surgery. Very interesting book actually, very useful and final book for any people, any student who learn surgery. My clinical method in surgery is covers everything, how to examine a patient, general examination to vascular disease, venous disease, breast, thyroid, neck swelling, oral cavity, then abdomen examination, rectal examination, then specialty examination, briefly ortho examination with the differential diagnosis in tabular form. with the instruments and specimens, and also with the video QR code in each chapter, where you can, if you click, you get a video of how to examine, like the hernia, you get how to examine hernia for 20 minutes, how to examine thyroid live or video in 20 minutes, how to examine breast lump 20 minutes, how to examine artery disease 20 minutes, like that, swelling, ulcer, everything. So it lot of photos to examine, and and differentiate that in the tabular form. But remember, it's a clinical book, no investigation, no treatment, no management concept. So it's a very useful, rather best clinical method book for surgery. So my clinical method book, Manual of Surgery, as a website, and my DigiNow lectures through JP Publishers for 220 hours covers everything. Examination, general surgery, operative surgery, all topics, GA surgery, specialty, everything covers it. Watch for CBM syllabus. So it will be useful. You can purchase for 1 year, and these three, if you have, you can learn surgery in the best way possible. So students, I hope you understood my lecture very well. Thank you so much.